Hi, what's up, guys? Welcome back to another interesting episode on the show Behind the Scenes in Hell with Dr. Ron. If you're new to this podcast channel or whatever you call it, my name is Ronald and I discuss everything about healthcare, health tech, alternative careers, and sometimes I do interviews with people to understand their journeys in healthcare. So if that's the kind of content you're looking for, you just hit the subscribe button, share with your friends and family. And to the returning viewers and subscribers, thank you guys for sticking around and supporting the good work we do on this channel. Now, on today's episode, I'll be looking at some of the factors that influence healthcare workers to, look to other careers or transition to other job areas or fields. And it's no longer news that a lot of people are transitioning, people are moving into health tech, which is the popular one. Some people are going back to school, some people are jack buying. So, what are the factors that are driving this movement, right? So in no particular order, the first one is burnout. Now, this is like top on the list for me. A lot of people are complaining. There's a lot of workloads. People are complaining about administrative workload. There's a lot of paperwork, politics, bureaucracy, and all of that. And that does not make the work environment really conducive for a lot of persons. And because of burnout, a lot of people are looking for jobs that gives them better work-life balance, really, and a lot of people say they don't mind having a pay cut as long as they have their peace of mind. So burnout is number one for me, top of the list. Now, second one, you talk about economic changes or better opportunities. Now, for people living in Nigeria, you're looking outwards because you're looking for better pay. And these aside other issues, maybe like security and all of that. But ultimately, people are looking for where they can be better paid for their skills, really, and value for their time. If, for example, you could get paid, 10 times more than what you're being paid at the moment, I mean, who wouldn't grab that opportunity to move? So economic considerations are one of the big factors a lot of people look at before they make that decision to transition or move to another career. Now, number three is education. A lot of persons are feeling, okay, it's time to get another degree, it's time to get another certificate, it's time to, add an extra body of knowledge to what I know now. So they probably take a break and say, okay, I'm going for that MSc or I'm going for that PhD. So you should always think education sometimes when people are looking to leave what they are doing at the moment to move to other areas. Now, number four, I should probably have said this one. Number two is toxic work environment. Now, I mean, without calling any institution's name or any facility's name, a lot of places where healthcare workers work are really toxic. You have bullying, you have harassment, you have people being told to do very weird things like going to bank for their consultants or washing cars. I mean, that's a different conversation entirely. And if people are constantly in workplace environments that are really toxic, that doesn't support their career progression, mental health, and all of that, naturally they're going to look for places that offer them a healthier working environment. And once they see that, the next thing is they just move over to those places, really. So toxic work environment is a big one, and I think it's something healthcare leaders or departmental managers or CEOs or medical directors should urgently look into, because I think it's a big contributor. Now, the next one is technological advances. Now, in the healthcare space, a lot of technological advancements are happening at rapid speed, and a lot of persons might feel, okay, they are not really equipped to, sort of work in this environment. And again, I think it ties neatly to the education part, and they say, okay, I probably need to go and pick up extra specialization or skill to come and be able to work with technology, because truly it's difficult to keep up with the trends of the way technology is moving right now in healthcare. So technological innovation advances is another driving factor that pushes a lot of people to transition into other areas. Now, another reason could be dissatisfaction in specialty. I think that's what I said before. I mean, this is not cast in stone. Before you transition or even specialize as a specialist or consultant in medicine, you really want to think hard about if is this really what I want to do for the rest of my life and all of that. So even though people get tired midway, they are dissatisfied with the specialty. Some people tell you they don't like monotony, like they're doing the same thing all over and all over for the next 10, 15, 20 years. So a lot of people halfway, midway, they become dissatisfied with what they do and they start looking out for other opportunities or avenues, really. And when you see people, switching from, core clinical medicine to, another area entirely, you begin to wonder why. So if you're wondering, this could be one of the reasons why they are switching. Really, they are just dissatisfied with what they are doing. And lastly but not the least, some people want to explore entrepreneurship, really build businesses and all of that. So these are some reasons why people transition or leave whatever they are doing and move into other areas. So next time when you're thinking why, you want to remember this video. These are some of the reasons. And until I come your way next episode, I still remain your host, Dr. Ron, and I'd like to say bye for now.